It's John Adams, the Rehab and Documentation Guru. I've been off for a little bit. I lost my father about 2 weeks ago and had to go down to Texas to be with my mom and my brother and go through the house, clean things out, do the service for my dad. It was a wonderful service. He was retired with honors from the military and just a blessing to be a part of that. And I know where he is, so I'm blessed by that. And if you want to know how I know, feel free to message me, and I'll be happy to share that in another fashion other than this channel. But anyway, I wanted to talk about something that you could relate to as a clinician. Do you know those times when you've had an administrator, when you've had a director of rehab, when you've had a higher up in your company, when you've had a third party liaison for an insurance company tell you that they think they know better than you in the delivery of the care that you seek to provide your patient. Whether it's not giving you enough visits, whether it's not giving you enough time to treat the patient, whether it's telling you that the patient needs to be discharged, and you know better. You know those times that you have that situation? Well, there's a similar thing going on right now in America, and it's related to COVID-19 treatment. There is a body of physicians, and not insubstantial either. There are quite a few that have come out and said, look, this is what we're seeing on the field that actually works. There was a group of physicians that came out the other day who not only cited personal experience as clinicians, but also some data available in studies that hydroxychloroquine, the use of zinc, and the use of zithromax together as a combination is an effective treatment, sometimes even for very highly comorbid patients who would ordinarily have severe complications. They've seen good results. And those voices are being silenced. It's kind of analogous to you being silenced when others outside of you interpose themselves into your relationship with your patient, and even though they don't know your patient, tell you they think they know better. That's a concern. Now, I'm all about being a third-party reviewer and giving clinicians feedback about how to make their documentation better. But one thing I really can't tell a clinician when I'm only looking at documentation is whether or not they're effective clinicians. I can't. Because some people they're awesome clinicians, they just don't document very well. And they're still doing very valuable things for the patient. All I can tell them is whether this meets, according to documentation, medical necessity or not. Sometimes I can glean that it's truly not evidence-based, not good treatment. But a lot of times I can't. All I can tell them is compliance-wise what I'm seeing. And that's the same thing that's happening to a lot of these physicians. They're saying, I know research is up in the air a little bit about some of these treatments, but let me tell you, based on the hundreds of patients I've treated, this is what I'm seeing. Another way that these physicians are being silenced is this. They're trying to come out and say, these are the pressures we're getting to diagnose people with COVID that probably don't have it. And this is what we know about false positives and false negatives on this test, which in some studies have been very high for the COVID tests. So if you care as a clinician, a PT, OT, or speech therapist, that people outside of your relationship between you and your patient are telling you what they think is good or bad for your patient, if you're concerned that that's not right, you should also be concerned that physician voices are being kept on the back burner, are being squashed, and not being allowed to say what they're actually seeing. There are three pillars to evidence-based practice. One pillar is research. So you have, double-blind studies, you have meta-analyses. Those are all very important. There's another pillar, to evidence-based practice, and that is the clinician experience with the individual patient. It's just as valid. And when you treat hundreds of patients with positive outcomes with a certain treatment regimen, it doesn't really matter at that point if you don't have a control group, because hundreds of patients makes an excellent study group right there and then. So what I'm saying to you as PTs, OTs, and speech therapists who might watch this video is please be mindful that the same argumentation in support of you saying that you have the most important voice in your relationship with your patient is the same argumentation that these physicians should be allowed to speak. Just some of my thoughts on this matter. Hope you're having a great day. Take care and God bless.